Hello and thank you for joining the Monday edition of Journalist Hangout. I'm Ayodele Ozubakun. Today on the program, Lagos records 500 COVID-19 deaths, blames inbound passengers for spread of third wave. Ifeanyi attacks Soludo over comments that WAEC school certificate holders should not be allowed to govern Anambra State, challenges him to a debate. And later on the show, in the aftermath of the ultimatum and threat by Emir of Muri, Miyetti Allah surrenders 11 suspected kidnappers to Taraba State Police Command. I'll be hanging out with Babajide Kolade Otitoju and Gani Kayode Balogun. So if you're ready, let the hangout start now. Thank you for staying with us. As the COVID-19 third wave spread further, the Lagos State Commissioner for Health, Professor Akin Abayomi, is certainly not a happy man. Professor Abayomi disclosed that more than 500 deaths have been recorded from various isolation centers across the state. He blamed these on inbound passengers as the state has successfully quarantined 448 passengers as at August 19. Today, Lagos State, in as much as they are trying their best to make sure they nip this pandemic in the bud, but it's like people coming from outside the country, they are bent in sabotaging the effort of the government, because some of them were said to have left fake addresses, some of them were said to have, just look for a way out, and they didn't go through what they are meant to do.
Yes, and it's unfortunate that it's Nigerians who are doing this to fellow Nigerians. What they cannot do in those foreign lands, they come and do in their country. In those foreign lands, if they say no, you cannot go out after 10 p.m., if they say no, you cannot, your salons cannot open as part of the measures being taken to arrest the spread of COVID-19, nobody will open salons. But in Nigeria, we just behave like laws are not meant for us. And it's such a terrible situation, because what we have from the record emanating from the Lagos State government indicates clearly that even when people present so-called PCR certificates indicating that they are that they are negative, by the time they get here and they do another test, it turns out that they are positive. Of course, that is why random testing is of value, because you could do a test this afternoon and be infected maybe 2 hours later. So it's possible that indeed, they were tested over there and found to be free of the virus, but shortly after the test, maybe even in the course of the flight or something, then they became positive. But to not submit themselves to the measures that have been put in place is what I find very responsible, and government must descend heavily on people who will come into our country and refuse to quarantine. Rather than quarantine, they will give fake addresses, give fake phone numbers and all that, so that you cannot trace them. Because when you can't trace them, how do you even, some of the people, the secondary and even primary contacts that they had encountered, how do we begin to treat such people when we can't trace them? They made tracing such people impossible, because they refuse to drop their real contact addresses. People always find a way around the measures that we put in place, either at our airports or other places. And that's why I'm saying that, look, we have to get more serious. This is a virus that evidence points inexorably to the fact that it is spread largely by air travel. That is how it came to different parts of the world. If there was no air travel, maybe it would have been resisted to China. But air travel was the main catalyst for the spread of this thing, and that's why governments are putting measures in place at the entry points into their country to ensure that, okay, we are not saying people should not come into our country, but people coming into our country, we should know their status, we should be able to monitor them, get them to quarantine, get them to do a test as soon as they get here, and then before they leave, they will do another test. So this is there's no big deal in this. For people, for frequent travelers, this is what they go through. Why people don't want it to happen in our country, I just don't understand. And they are the ones, the Commissioner for Health in Lagos was right. They are the ones causing the spread of this third wave. This extremely dangerous and highly transmissible third wave. They are the ones causing it to spread when they refuse to quarantine.
It's like some Nigerians, during the first and second wave, they took it, especially people in the Lagos axis, they took it serious. But they are finding it difficult to adjust their lifestyle, to go back to the non-pharmaceutical interventions that has been preferred. Now, talking about this third wave, some people are still not taking it serious, and it's said to be deadlier.
No, it's not only deadlier, it also kills faster. Because, and this one is even attacking those who are fully vaccinated. That means they're also susceptible to infection, which to me is the danger that we face as a people. Don't forget, I don't have the figures now, but I know we've done less than 1% of our entire population when it comes to those who have taken complete dose of vaccination. But also don't forget that about 334,000, again, I don't have the figures. 334,000 are people who took the first dose and did not come back to take the second dose.
I wonder,
those who are coming to our country...
What's the essence of taking the first dose without coming to...
So basically what you said, because when they took the first dose, they thought they were in danger. Then when the thing went away, not totally, they assumed that nothing will happen. So that's why a lot of people just...
waste of resources.
Not only resources, it's even dangerous to them, because the one they took was half, and can only work halfway.
It's better you didn't take at all.
So it's better for your body to develop its own immunity than for it to be assisted halfway. So it doesn't work either one way or the other. I think what Dr. Wayami is saying, and I really pity the man, because he had been a victim of COVID himself. He knows the danger that you face in the public space, especially those coming from the airport. The news is distressing, because like I told you earlier, those who come to our country with this thing, the Delta variants, most of the time are short-term travelers. Those who spend 2 weeks, 3 weeks, and go back. So to even trace them, because it's so short, is a particular problem. Now the contacts they've come across is people that we cannot run away from. I think what we need to do now is tell the government to be more proactive. If a person gives you an address, please, no matter how much hurry the person is in, you must verify these things before they're allowed to leave the airport. It will be inconvenient, of course. A lot of people will feel the inconvenience, I agree. But it's better for a few people to suffer a few minutes of inconvenience for the entire Lagos state to start having this problem.
Going through these charts, the isolation center in Lagos, 600 bed capacity. Lagos is maybe this one particular center, but for a state of over 20 million people, it's just like a drop of water.
1 million passengers per day.
And that's why our best bet is to not
just avoid it.
Yes, because look, if we were to experience a full-blown attack, if I can use that word, full-blown attack of the Delta variant in our country, we are not going to survive it. We cannot. No. We do not have the health infrastructure.
What happened in India must not happen.
We do not have the health infrastructure to survive it. We do not. I've said before that, look, Abuja, the FCT, it has a population of 2 million people. the entire bed space is just about 30,000. Now, if COVID were to brutally descend on FCT, God forbid, what do? With just 30,000 bed spaces. We don't have enough oxygen. This particular variant is a guzzler of oxygen.
Yes.
As soon as you contract it and you need help, you need oxygen right there because it attacks the respiratory organs. Now, we are just in the request for more money that the president made. The environment that was approved the other day by the National Assembly. Part of what the money that the president is asking for is to build an oxygen plant. Because what we experienced in December when there was oxygen shortage, many lives were lost.
Yeah.
Especially in Abuja, even some VIPs. Because at the isolation center, they didn't have oxygen for days. So in order not to face this kind of problem again, the government wants to build oxygen plants because we know that this current strain of it consumes oxygen a lot. It requires oxygen. So this is the thing. Our people have to do the needful. I was going through some of those so-called red countries and the cases that they have recorded, and I was really, really terrified. Turkey has recorded 6.22 million cases and has recorded 54,000 deaths, 54,733 deaths. USA, 37.8 million cases. But the USA has recorded 628,000 deaths. India has recorded 32 million cases. Is following US closely. But India has recorded 429,000 deaths, which is huge. At a point, we thought that India was managing the thing. Suddenly, they lost control. Brazil has 20,570,891 cases. But Brazil has recorded 574,000 deaths. And currently, they have 547,000 infected because the figures come out every day. So look at all of these countries are ahead of us by far. We can't even compare ourselves to them when talking about health infrastructure, their capacity in the health sector. But look at the way people are dying in those countries. So we just have to be careful. We are fortunate as a country that this thing, when you even look at what South Africa is going through, Nigeria is a very fortunate country. It has pleased God to bless us so much, you know. So, yes, they have no choice but to cremate people. Where are they going to bury them? Where are they going to bury them? So, we have to be stricter. We've talked about how Rwanda manages this situation. You could say that Rwanda is just a one-city country. Yes, but if you are coming into my country, and Lagos is the #1 entry point into our country. Yeah. That's why Lagos suffers a lot. When you look at the figures on Lagos, you see clearly Lagos 166 new cases. And the closest will be 76. That is Rivers. You know, talking about the current cases. So Lagos is the #1 entry point and the #1 departure point from our country. If it is Lagos that we have to focus on, get the federal authorities to work with Lagos State to ensure that we are able to track these inbound passengers a lot more, then we have to do it. Once we can handle the situation perfectly in Lagos, honestly, everything will be fine.
All right, we have Otumba Bolaji on the line from Abuja. Thank you for joining us.
Yeah, I'm lucky to meet you today. I've always been following you since the past 2 years.
You're welcome.
So I'm lucky to get you today. This thing you are speaking about, the question I want to ask, Mr. Tisoloju, you have been giving them facts and figure. Does the government work on these things? It's like they are losing bearing, and we are taking it for granted. I want to portray what you have said in respect of the entry points. Why can't we put a sanction on all airports that is bringing our people? Because this is airborne, and we know it's we call it aeroplane, and it's airborne. Why can't our government do something? Why do we have to wait until things get worse? I remember when this thing was coming up, like what you have been explaining every day, that people ask, people fake addresses for us to cure ourselves. And when you get into the community, you spread it to thousands of people. Why can't the government look for what can prevent it than looking for this? Now here they say they want to build the oxygen plant. It's not automatic. Why don't we use the word prevention is better than cure, my brothers?
Thank you. Thank you for your contribution. GKB, from what we've said so far, and when the first variant came, when the second time that we had it, second wave, sorry. So I thought the federal government and the state governments will use that window to put some things, because the weaknesses of our health sector and everything, we saw it, that they will use the opportunity to put some superstructures in place so that subsequent things, as we are witnessing cholera, any epidemic or disease outbreak, that we know a way how to curtail it. But we never learned anything, and nothing is in place. And we keep praying to God that somehow, God, we believe God is a Nigerian. He has been saving us from this.
And he will continue to do so. There are 2 points, really. Number one is the fact that I did not agree that they did not learn any lesson. Only that they learned the wrong lessons. Because normally the lesson we ought to have learned was that this is how this thing transmutes. Don't forget that as early as the second week, professors have been telling us that this variant is going to get more dangerous. They're going to be more vicious. That the one we started with are just like, I don't want to use the word, lightweights. That they will move into a place where it becomes very impossible to attack. But luckily today, the FDA in the US just approved the Pfizer vaccine totally. That means no longer conditional. That means they now have things to fight this. What we need to do first is what Gideon said. Let us be articulate when we are telling people what is expected under the protocol. We still have sacred cows who come in private jets, who don't obey the protocol. We still have flights that are delayed in such a manner they don't go through the protocol set by the government. We have flights that are coming in from certain parts of the world that were on the list when we first started, that had not been opened up, and there are no special attention paid to them. This, of course, will accumulate in what we are suffering now. What we need to do right now is very clear. Let the two governments, the state and the federal government, come up with more articulate protocol that cannot be disobeyed. That's the only thing. Stop telling us that because tracking is simple. Nobody's coming to Nigeria without a passport. The passport has their digital imprint. This can be traced. The only problem we have is that we cannot trace those they've met along the way.
Yes.
But the first step must be something we can do. If somebody said, my name is Mr. A, and he's not there, put his picture in the newspaper. This man has absconded.
Yes.
He's a danger to society. By the time you do that, 10, 15, 30 people will sit up. Because somebody somewhere will know him. I will tell him, I saw him yesterday. And that's how to go about it.
Okay, now,